A 60-year-old male presents to the emergency department complaining of a severe headache. Over the past few weeks, he has had difficulty moving his eye. Radiographic studies reveal an internal carotid artery aneurysm within the cavernous sinus. Which of the following cranial nerves would be initially affected by the aneurysm and may explain the difficulty in moving his eye? Talking about my cavernous sinus, you want to be able to know the artery that's going to be located within the cavernous sinus will be my internal carotid artery. At times, the internal carotid artery will have an aneurysm. And when you have an aneurysm, we're going to be worried about the adjacent structures around this artery because they're going to be compressed. First thing you want to notice is that the closest nerve to my internal carotid artery will be cranial nerve number 6, my abducens nerve. Therefore, if someone is having some compression to your abducens nerve, therefore they're going to have some issues with the lateral rectus muscle. You want to be able to pick that up in a question, especially if they're discussing someone with some sort of medial gaze, and when asked to look laterally, they will have the inability to do so. You would like to use the symptoms the patient has to be a guide towards picking the correct answer related to the structures compressed. Therefore, you want to be able to know the cranial nerves that we will find in the cavernous sinus. The image below will highlight the cranial nerves. Therefore, dependent on the types of symptoms, we will be able to be aware which cranial nerve has been compressed. We would like to know all the structures within the blue boundary because these are the structures within my cavernous sinus, especially as it pertains to my cranial nerves. We're going to have cranial nerve 3, oculomotor, cranial nerve 4, trochlear nerve, cranial nerve 6, abducens nerve, and my cranial nerve 5, V1, ophthalmic, and maxillary nerve V2. It's important to be aware that the cavernous sinuses are part of the dural venous sinuses. Therefore, they will be receiving blood from the cerebral veins, the emissary veins, and the ophthalmic veins. These extra cranial connections will give the ability for spread of infections to go from extracranial to intercranial due to this connection to the cavernous sinus. Going back to the question, we were asked which of the following structures would be affected first due to the internal carotid artery aneurysm within the cavernous sinus, and we know that my abducens nerve is going to be adjacent and closest to the internal carotid artery. Therefore, that would be the best answer. Don't forget to like and subscribe to the YouTube channel, and if you have any questions, don't hesitate to contact
Med Tutors.